Like our mission is to expand safe, legal, and equitable access. And what about safety? How do we balance that? It's like if we're going to be promoting, in a way, access and promoting knowledge about these substances, which I think is very important. I think people need to know that they exist and how they could potentially be beneficial. They also need to know how they could potentially be harmful and how to mitigate those harms.
Welcome to Intonicated, a podcast about psychedelics, learning, and well-being. Intonicated is an adjective that describes a heightened, expansive, and health-affirming state of consciousness marked by clarity, vitality, and integration, in which a person feels inwardly attuned and stretched towards deeper awareness, emotional resonance, or spiritual growth. I'm your host, Kenneth Tupper. Please be sure to like or subscribe. Okay, welcome to Intonicated, conversations about psychedelics, learning, and well-being. And joining me today is my good friend and colleague, Rielle Capler. Rielle, do you want to say hi?
Hi, Ken. Really nice to be here on your new podcast.
Thank you. First of all, do you want to just tell us a little bit about yourself?
Yeah, I mean, just basically, I would say I'm currently the executive director of MAPS Canada. I'm an adjunct professor at the School of Population Public Health at the University of British Columbia. I'm a researcher and advocate and educator.
Awesome. Well, I'm looking forward to a conversation then. I know your background is in medical cannabis access. Can you talk a little bit about that background and the transition that you've made into the space of psychedelics with MAPS Canada?
Yeah, I think that I don't know. I think that's my interest in psychedelics preceded my interest in cannabis and medical cannabis. And I think it was related to MAPS US. And somehow in my mind, and I don't know, I don't have all the times right, but I know that MAPS US, the OG MAPS was created in 1986. I was a teenager. And somehow I knew about it because, we didn't have internet. So how did we know about anything? So I somehow knew about it. And I think it was from their journal, their bulletin that was published. And I was in Toronto. So I believe, I had a very precocious, smart friend who would, frequent the magazine stores and, that's how we would learn things. There wasn't the internet. So I believe that's where I found it. And I just was fascinated with psychedelics and neuroscience and the potential impact on mental health, and saw it as an alternative to pharmaceutical drugs for mental health, which was the only thing available, in Canada that was covered under our healthcare system. And
Can you speak to the maybe discordance, I guess, with other sort of more mainstream cultural messaging that you had about psychedelics when you first encountered MAPS?
in what way?
Well, I presume we're going back like 20 plus years, and your sort of broader cultural environment at that time was not favorably looking towards psychedelics in any beneficial ways. Yet you came across MAPS, and how did that sort of understanding shift happen in your mind?
Yeah, that's very true. At the time, it was very much, the connotations were of like jumping out of windows and dying. Like I had, read The Outsiders. I don't know if you remember that book by S.E. Hinton as a teenager. And there was, I think it was in The Outsiders. It was one of those books. And there was a character in the book, Eminem, I think, and he had a bad trip. And he, it was all around spiders and it was awful and it ruined him for life. And that made me very cautious and afraid of psychedelics. So, I was kind of in that context, but I also had a lot of personal curiosity about them. I had tried cannabis. I was using cannabis as a teenager. And I was interested in mind-altering substances. Like I was seeking it out. But I think that learning about it from that way, like from MAPS and in a scientific context, was really beneficial for me because I was curious about them. And this way I got to understand them. And I don't feel that it was endorsing them or trying to tell people to take them. Like what I was learning was just that this is how they worked in the brain. Like there were mechanisms that it worked and there was research about them and that there had been past research, how it had been used beneficially. So yeah, it definitely contradicted what was in the mainstream.
Yeah. Can you speak to your transition then, I guess, from that preliminary interest in psychedelics into the medical cannabis space, and then back again more recently in your entry into MAPS Canada?
Yeah. So I think that led to me being interested in psychology. So I studied that for my undergraduate degree and was going to pursue that to become a clinical psychologist. I was on my way, I was all signed up. And then I just started thinking about our healthcare system and who gets access and what they get access to with universal healthcare. And I detoured and I wanted to learn about the healthcare system and why only pharmaceutical drugs were covered and why there was a lack of, I think, um, attention to mental health, I would say, and I wanted to learn about that, the healthcare system and what I would be a part of if I became a therapist. So I detoured and did a master's in health administration, which was basically like a business degree for healthcare, for nonprofit healthcare in Canada, and learning about the whole context as well. And I was focused on mental health when I was doing that and natural healthcare. Those were kind of the areas I was focused on. That wasn't kind of the program was focused on, but I
Right.
tried to do
Yeah.
that. And by chance, when that was over, I was visiting with some friends in the Kootenays and connected with activists from across Canada who were working on cannabis, and they were meeting in Grand Forks. And I was invited to, like, we drove somebody to the meeting. My friend and I drove somebody to the meeting, and they invited us to come in. And we ended up I had a lot of experience facilitating. And so I ended up facilitating the meeting, got connected with all these really incredible people who were just so passionate and caring and all coming from really different places and all wanting something different, like having a different way of how to get there. So it was fun to facilitate. And then I met a person who was on one of the founders and on the board of the first Compassion Club in Canada, the BC Compassion Club Society. And he was like, "Hey, there's a bunch of amazing women who have started this organization, and your background would be really great for that." So it was a great fit. I was connected with them. I got to use every iota of that degree, from
Mm.
like queue management, lineup management to, managerial accounting. So it was really a great fit. And it was really philosophically and ideologically in line with what I was interested in. So they were, using the profits from selling medical cannabis to provide natural healthcare services. And I loved it. It was great. We used consensus, which I really liked, consensus decision making practices, which I'd learned from activism and really liked. And then I guess because I was in that realm, that was like a legal gray zone, and I was comfortable in it. Uh, People reached out to me to do work in psychedelics as well. So I was doing research also when I got involved with the Compassion Club, and I love research. And I think you know with other people, you included actually, who were aware of compassionate use and wanting to help move that forward and knowing the importance of research. I got involved in a study that was looking at the use of ayahuasca for stress and addictions in a First Nations community. And that was my first involvement with psychedelics research.
Nice. And now you're leading MAPS Canada. Can you tell us a bit about the distinction between MAPS Canada and MAPS USA? And I think there's now a number of other sort of nationally based MAPS organizations that are offshoots like MAPS Canada.
Yeah, there's some global affiliates. We're a global affiliate.
Okay.
So that's we are, that's our relationship as an
Mhm.
affiliate. We're governed independently, but we are, sister organizations, and we collaborate and we communicate, and are supportive of each other. And we just had the first meeting of the global affiliates the other week, and it's really great to be connected because there's a handful of us. There's a lot of organizations in the world that are working on this, but it's nice to be connected with the other MAPS groups. There's MAPS Israel, MAPS Germany, MAPS Italia. So yeah.
And do they all sort of carry the same mission, vision, sort of general mandate as maps, or to what degree is, I guess, their national level autonomy? I mean, obviously, you're all kind of rowing in the same direction, but just
Yeah.
curious to know the
Yeah.
distinctions as well as similarities.
I think what's really interesting about it is that we all have different contexts. So we're really in our national context and what's happening there, but we're all looking at, like I don't even know if we all have the same mission statement. Like ours is to expand safe, legal, and equitable access to psychedelics. So I think we're all pretty much in that ballpark, but very different national contexts.
And I guess even MAPS USA has been revising their overall mission mandate, et cetera, given the decision and spin-off of MAPS Public Benefit Corporation to Lycos and the decision by the FDA, leaving MAPS sort of going back to its roots, I think, in some ways. I don't know if you can comment more on that. It's not, I guess, quite
Really
your...
comment more on that.
Yeah.
It's, we're separate organizations.
Yeah, yeah.
But, I get that sense as well.
Yeah, cool. Wonder if you can talk about, I know you recently, MAPS Canada recently hosted a webinar on sort of similarities and distinctions between cannabis and psychedelics. I'm just wondering, or to the degree that, yeah, those are different categories. I'm wondering if you can talk about some of the learnings that you got from all of the contributors to that webinar series.
Yeah, that was really good. It was a course in our MAPS Canada School of Psychedelics, and I want to plug that one because it was really good. It was our 2025 course, Cannabis and Psychedelics from Conceptualization to Care was what it was called. And it came about from a conversation I was having with a previous board member, Rielle Capler, who works as a therapist with psychedelics and cannabis. And we were talking about, is cannabis a psychedelic? Why does that matter? Who does it matter to? And we thought, let's explore that. And we brought in a lot of really great minds to have those conversations. So there were 3 courses. You were in the first one, which is about conceptualizations and community. So it was more of a, higher level philosophical and social, societal kind of conversation. We had another one about mechanisms, and Kayla was part of that. And there was also Pedro Amdara from a patient perspective. And then we had another one that was around mechanisms of action, therapeutic uses. And we had Zach Walsh, who's a great researcher on that one. And Kayla joined that as well. And Gordon Hurley from a patient perspective and a veteran. And then the other one we talked about, legal pathways and policy pathways. And we had a great lawyer, Nicholas Pope, on that, a longtime activist and advocate and everything, Philippe Lucas, and a patient, Allison Murden, longtime patient and advocate for both cannabis and psychedelics. And so we had courses, everybody shared content, and also we had great conversations. We had panel discussions around these topics. And what came out for me, like, in the end, all of it's really interesting, and I highly recommend listening to everybody and what they all had to say. But what I was thinking about was just how, with medical cannabis in particular, it came about in terms of patients, needing access and care, was for medical conditions and symptoms that were more physically based. And for psychedelics, it's been more around mental health. So there are people who use cannabis for stress and depression as well, and there are people who use cannabis for that. There are people who use psychedelics for pain and other conditions, but primarily where the traction has been for compassionate use and legal medical access for cannabis has been around physical conditions and symptoms, and for psychedelics, mental health. I think it's interesting, why it was worthwhile to look at this was to look at how to balance safety and access and optimize beneficial use and reduce harmful use, and through regulation. So I found with cannabis they regulated it in ways very similar. A lot of times they just cut and paste for alcohol, and they are very different substances. So really looking at what are the differences between psychedelics and cannabis from all those levels that we looked at, so you can really be making decisions and regulations based on what these substances are.
So one of the terms I think that came up during that series was psychedelic exceptionalism. Can you comment on that? Are you a psychedelic exceptionalist?
Well, it's funny. I think I asked you to talk about that.
You go first.
Okay, and then you could go. I asked you, see, like, why we got people to do that course was so we didn't have to do all the, learning and thinking about it. I don't know. Like, I don't think I am. I think that there are, some substances that are easier to bring into mainstream use, and for people, for society to get their heads around, um, and to regulate, frankly, in a good way. Like, there's ones that are easier to do that. So maybe those ones, are done first, but I don't think that I demonize other substances.
Sure. Yeah, I don't. I personally, I would say I am a psychedelic exceptionalist, but don't think that that takes away from the need for drug policy reform and recognition that people shouldn't be criminalized for the substances that they're using. That war on drugs has been a colossal failure, but at the same time, the class of substances that in psychedelics are somewhat different in terms of the potential risks and harms and benefits. Just that even the sort of neuromechanisms of action, it to me felt different enough. I even actually think ketamine doesn't necessarily fit in the psychedelic class myself, but I'm totally open to and well, recognize that there's lots of science now showing ketamine has lots of therapeutic benefits when used as a kind of psychedelic in therapy settings. But I guess I've been schooled enough by some of the biochemical purists to think that, yeah, they're the sort of classical psychedelics are the ones that fall most neatly into a nice category like that. So,
I mean, it's an
uh,
interesting question because when we talk about psychedelics, what are we talking about? People will, often respond when we talk about MDMA. They're like, that's not a psychedelic, so they are so different, all those substances. So, even though
yeah,
we like talked about, or, the similarities and differences with cannabis and psychedelics, you could do that for each substance, really.
there's a heterogeneity that isn't adequately captured by the single term
Yeah.
psychedelics. And certainly historically, I found it strategic not even to use the word psychedelic for quite a long time. I preferred using the word entheogen, which still I think has got a nice place for sort of denoting the ceremonial sacred uses of plants in traditional settings. But since the word psychedelics kind of been rehabilitated over the last couple of decades, I'm much more willing to embrace it and recognize that often it's about intention and set and setting and matrix that leads to the kinds of outcomes. And that's true, I think, with all drugs, but particularly with psychedelics.
Would there be a new classification called intonicants?
Good one. I hadn't thought of that. Perhaps.
Mm.
Um, Can you talk about one of the areas I think MAPS Canada's been working on is equitable access? Can you talk more about what that means, how underserved communities can better achieve potential healing or therapeutic or other benefits from psychedelics?
Yeah, I mean, I think generally we know with all healthcare, there's not equitable access. With many resources in society, there's not equitable access. So that's something that we want to focus on and keep the spotlight on. I think the way we're doing that is by making sure that all the voices possible are at the table. So, for example, in the school psychedelics, we had patient voices in all of our courses, or in some of our other courses, we have Indigenous perspectives in all of our courses. We we did a policy paper with Alberta, like on Alberta's regulations. It was called Balancing Safety and Access, and then we looked at that from different perspectives and in different contexts. And so we did a webinar series on that to have public dialogues, community dialogues around that, looking at different contexts and different perspectives and different communities. So I think it's just something that has to be, we have the opportunity. Like, I think when there's a new something, it's not that the substances are new, but regulating them and bringing them into the context of society in different ways, recreational or medical, it's an opportunity to do things differently and from the ground up be paying attention to equitable access.
So, how do you square that with the sort of standard drug development impositions of regulatory agencies like Health Canada, the FDA, or European Medicines Agency, where there's a pretty well-worn path that involves intellectual property and tens, if not hundreds of millions of dollars investment for the kinds of clinical trials to show safety and efficacy that then needs, or it is argued, requires return on investment for the folks who are putting that money up front. Um, can you comment on that?
A little bit. I mean, like what it's making me think of as well is just how that also, comes forward when you talk about commercialization. That's something that It's even with the like sales and distribution, who gets to be involved in the marketplace at all. And it's, again, something to be considered early on, as early as possible. I know that, like, with cannabis, we were very concerned, like looking decade in advance or more in advance, as the conversations were happening at different levels of government, to look at who's going to be involved in this new marketplace. For example, in British Columbia, cannabis producers were the backbone of the economy. So, talking way in advance, just making sure that there would be room for small scale growers. And I mean, some provinces dealt with it better than others. Some let there be more monopolies. Other provinces tried to keep it open for more involvement. But then, for example, in British Columbia, they did that. They set some policies that you know didn't have too many franchises. You could only have so many shops. But then the government, provincial government, actually competes against those independent growers. So just thinking about who's involved, who has access, in terms of how the costs of these medicines that's a whole other thing, in terms of, again, are they going to be provided in the context of therapy? How does that get paid for, again, in our provincial healthcare system? How is that being covered? But then who's involved in the marketplace? And so one thing that we learned from cannabis as well was that the federal government, when they rescheduled and they created regulations for legalization, they did not properly consult Indigenous First Nations, Indigenous and Métis community at all. So that's something that we need to be speaking about loudly and as early as possible.
Yeah. I'm sure there's lots of lessons to be learned. Just commenting on your observations about cannabis and the way it's rolled out in terms of legalization and regulatory oversight. What are the key lessons that you can see being applied to the space of psychedelics from that experience?
That's a big question. So it's easier to do the lessons, like, as we talk about each subject, each
Sure.
thing, because overall there's so many. Yeah.
Well, one question, I guess, is the business model for cannabis, and maybe correct me if I'm wrong, I understand is more like alcohol and tobacco, and that the majority of revenue is actually coming from a small subset of people who are using, very regularly on a daily, multiple times a day basis, and that the sort of casual user isn't a big revenue generator. So there's never going to be that much interest in sort of marketing, promotion, and sales to that group. I don't think it's widely talked about, but I think it's widely understood. Same thing with gambling. Whereas psychedelics may be different. Microdosing, that's something a little more regular, but again, not in quantity. So some of the questions that have arisen in my mind around the potential business model for people who are looking to be entrepreneurial in the space of psychedelics. Is MAPS Canada involved in any of those types of discussions or?
No, but it's interesting because, like, that is something that's been on my mind when we did that cannabis course. We were going to add another section to it around looking at that business perspective and comparing cannabis and psychedelics. And we didn't get to that one yet, but we can add it to it. But no, they're definitely, again, that's why you have to look at different substances and how they're used. It's something worth looking at. Very different.
Yeah, and I mean, certainly there are sales happening of different psychedelic substances in sort of underground dispensary type outfits or certainly online, but the legitimate pathways, again, are sort of having to follow the course of drug development and phase 2, phase 3 clinical trial development. So, yeah.
And it'd be interesting to see how, like, I haven't looked at it too much and I want to do it more. There was a paper that came out recently by Mark Hayden about the mushroom shops that I haven't fully got my head into. But yeah, like, having these, how would it change use patterns by having these substances available? I mean, I remember one day doing a tour of all of the mushroom shops in Vancouver. I was just curious. And it was a Friday afternoon and I was downtown in one of the shops and it was packed. It was, like, super packed. And I just remember thinking, this is so great. These people are not getting alcohol. Like, that's really good. So I think there could be some great benefits for people having access to these more widely.
Interesting. So putting your crystal ball in front of yourself, where do you see things going in the next 2, 5, 10 years? Any projections on how things are going to unfold?
That's such a hard question. It's a hard question. I remember talking to an ex-colleague of yours, Brian Emerson, years and years and years ago, and when I was first at the Compassion Club, and we sat down in this like herbal dispensary, and he was saying, how long, like what are your expectations, kind of how long this is going to take? I was like, we're doing this like in the next like 5 years. It's all going to be legal. And he's like, some like expectation settings about how long things are going to take and just the route to it. And then, and then things happen in the courts. And then all of a sudden there's this political will and it can happen overnight. So it's very hard to know. I do know that there's growing interest, and that again Alberta was the first province to regulate. Like it's there, and the colleges, the professional colleges and associations, everybody's looking at it, so it's happening. And I think it's in practice, so I do think that things will be, hopefully there will be more access for people in need, because part of being at MAPS Canada, I'm looking at people's emails, and there is a lot of need. There's a lot of need, and people don't know how to get access. There's one program that the government has provided, the federal government that has provided, that's overtaxed, and it might not be the best program. And I think that right now that's like the most important thing. Right now they're offering MAID, medical assistance in dying, to people before they're getting access to try psychedelics to ease their suffering. And so that really needs to be rectified. And I think it will be in the next few years.
You're talking about the Compassionate Access Special Access Program?
That's the one.
Yeah. And is MAPS Canada involved in facilitating access to that in any way, or are you referring folks to, because I know there's a number of clinics that are now
Yeah.
helping people with that?
Yeah. I mean, we don't provide, MAPS Canada doesn't provide services, but what we have done is create a community of practice for healthcare practitioners who are hoping to support their patients access psychedelics through whatever means, legal means are available. So we have a great community of practice with about 200 practitioners across the country at the moment. So that's what we're doing to support access and having conversations. We learn from them what's going on and what barriers are coming up in real time. Are, responses from Health Canada taking longer than they used to? Are they getting a certain kind of feedback as a trend? And that helps us with our advocacy and to be able to have, give feedback and try to have conversations to help improve those programs.
Great. That sounds like a needed project, so thank you. You mentioned public health, Brian Emerson's work, and you're at the School of Population Public Health. A lot of the work in psychedelics is focused on treating indications for illnesses for people who are in need, and that's great, that's important. But there's a broader potential public health angle to be looked at with respect to psychedelics. Just wondering if you can comment with that particular lens being applied to potential benefits and risks or harms with psychedelics.
Yeah, tell me more from what, like, I'd love to hear more from your perspective. I know you're getting involved with a public health group. So,
Yeah, well, there's a new Center for Psychedelic Public Health that's been started up in the US. Heather Kuiper and Missy Wooldridge are two of the co-founders. And yeah, looking at various aspects of public health. But I mean, I can refer folks to that website, but I'm just curious from your perspective, what you think about the public health angle or population health, and to the degree that those two things are distinct. What's your take on that?
I'm I'm still not quite like, I'm not feeling as like sure like what you're specifically asking, like the difference between population health and public health, or
Well,
help me
I'll
out a
put
bit
it
here again.
sure. I mean, this is more of a discussion question.
Mhm.
Are population and public identical, or are they different? I mean, there's obviously two words in the School of Population and Public Health, and often those two things are like in my former part of the Ministry of Health. I worked in the
Mhm.
Division of Population and Public Health.
Mhm.
But like, what's the difference between public health and population health? I think that's a really sort of interesting question for folks who are rooted in that
Yeah,
world.
yeah.
But as say, the momentum for psychedelics is as medicines to be treating specific illnesses. But that's not public health, in my understanding. Public health is a much broader set of endeavors that are about regulation, policy, education, etc., and not about individuals necessarily, but about groups, communities, you know, subsets, subpopulations. So just again, thinking about that lens being applied to psychedelics and how the movement of legitimacy for psychedelics as tools not just for potential healing, but even more broadly for learning, spirituality, those kinds of things.
Yeah,
Does that
I
help?
also, yeah, it helps. It does. But, like, I guess what just comes to mind for me is also around harm reduction use. Um, so looking at the broader level of population health, public health. Yeah. But is just thinking about that, harm reduction again, like I was mentioning about, people using, one, using it instead of other substances, reducing their use of alcohol, for example, or opiates or other substances that are causing harm in society or could cause harm. So I see that as one thing. Also, just about, public education, but like more education um, about safe use, really, and about potential harms. And that's something that we start to look at. I've mentioned to you that some of our advocacy with the government, and a report we wrote was called Balancing Safety and Access. And that was us talking to the government to say, I know that you're in your regulations. It's very important to be focused on safety, but it can't be to the exclusion of access. Access is also important. And then I was looking at MAPS Canada, for example, as one of the institutions that has credibility and shares information. We also, like, I thought we have to balance safety and access as well. Like, our mission is to expand safe, legal, and equitable access. And what about safety? How do we balance that? And so we had some people from our community come to us talking about some of the harms that they had experienced and wanted to do something with those harms. They wanted to put them to good use and to make sure that other people maybe wouldn't have to experience those same things. So we created a psychedelic safety team to really get that part out. So I feel like that's kind of where I'm at right now. It's like if we're going to be promoting, in a way, access and promoting knowledge about these substances, which I think is very important. I think people need to know that they exist and how they could potentially be beneficial. They also need to know how they could potentially be harmful and how to mitigate those harms.
Yeah, that's great. Great response. Thank you. It makes me think of the question for so long has been like, how can these substances help people who need them? But then the corollary is for whom maybe are they not appropriate? And I think that's an important scientific question. That's, there's a lot of exclusion criteria for most of the clinical trials that I think are based on a precautionary principle that's obviously valid at this stage of development and research. But further questions need to be sort of establishing when true contraindication may exist for pre-existing mental health issues, and that recognizing that these aren't panaceas, that there are some folks who maybe are best seeking other modalities of healing. So
It's
that's
also
and
about, preparedness. So it's not just that, is it good or bad for you, or is it contraindicated or not, but even, just how to be prepared. And that's something that our team as well at MAPS Canada is working on, just having that for people to individually be able to understand if they're prepared and what to do to get prepared. Because it's
right,
like,
yeah,
we know that it's, preparation, set and setting, dose set and setting, and integration. So that preparation part is very important.
yeah, that's very important consideration. I think also there was a psychedelic safety summit held earlier this year that tried to advance
Mhm.
this conversation. Moving away from the war on drugs, just say no rhetoric that was applied to all drugs for the longest time. But at the same time, recognizing, yeah, there's potential value here, medically, spiritually, etc., and bringing those conversations together in a sort of higher order way to recognize there's both potential benefits and risks, and that we need to have mature discussions about those. So that's it's good to know you. So what's the MAPS Canada piece that you described as sort of psychedelic safety?
Psychedelic safety, we have a psychedelic safety team. And so right now
Okay,
they've been putting out some infographics from we have a pharmacist who's been doing that. So just things that, so people
nice.
can understand what are these, but there's a team also working on some preparedness guidelines or resources. Um, there you can look on our website too. We'll have a page for that soon, and to share other resources that can be helpful for people. to keep safe. And, just talking about integration too, that's also a safety side of it. The integration part is where a lot of harms can happen if people don't have proper integration. So our theme at MAPS Canada this month is integration. And I think it's tomorrow, we're having a research presentation from Amy Bartlett, who's going to be talking about the role of community in integration. So I'm fascinated. I'll be there. And I'm looking forward to learning about that. But I think, again, like paying attention and really, as we speak about access, also speaking about the safety sides of it.
Yeah. Well, that sounds great. I think we're approaching close to the time that we had allotted for this conversation. So I really appreciate you joining. Do you have any last words you want to finish with?
No, thank you so much for having me on your new podcast and for coining a new word.
Thank you. It's been a pleasure. Thanks so much. Take care.
You too. Bye, Ken.
The content in this podcast is for informational and educational purposes only. It is not intended to provide medical advice, diagnose, treat, or prevent any disease. Always consult a qualified healthcare professional before making decisions about your health or the use of any substances discussed here. Psychedelic substances remain illegal in many jurisdictions. Listeners and viewers are responsible for knowing and complying with the laws in their area. The views expressed by guests are their own and do not necessarily reflect those of the hosts or affiliated organizations. If you choose to explore these topics, please do so with caution, respect, and awareness.